Hi everyone, I am Dr. Shahan and today in this video I will teach you about Refsum disease. Now why I have chosen Refsum disease? Refsum disease is very important for NEETPG and inicet examination. Refsum disease basically is a metabolic disorder and it impacts the pathway that break down phytanic acid which is found in food. So what happens when you have Refsum disease? When you have Refsum disease, there is a metabolic problem, and because of this problem, the phytanic acid which needs to be broken down with the help of an enzyme, that is not possible. And so the phytanic acid will be accumulated in various parts of your body, and this will leads to hearing loss, vision problem, and also retinitis pigmentosa. Retinitis pigmentosa is very important here because they always give questions regarding retinitis pigmentosa which is associated with Refsum disease, and sometimes they also says that Refsum disease has loss of smell, peripheral neuropathy, hearing loss, all these are there. So remember Refsum disease. Refsum disease is a genetic disorder, and basically what kind of genetic disorder? It is autosomal recessive genetic disorder. Autosomal recessive genetic disorder, you have to remember. And those who have Refsum disease, they generally lack an enzyme, and that enzyme is needed to break down which acid? To break down phytanic acid. Very important for your exam. They ask you which acid breakdown is not possible in case of the Refsum disease. They will give you in the MCQ phytanic acid, Refsum disease. From the F, REFSUM, you can remember from the F, phytanic acid. So this phytanic acid, when it is it cannot be broken down, what it does? Basically it goes to brain, it goes to the blood, it goes to different body tissues, and when it goes to the brain, it can also cause ataxia. Very important, ataxia. And it can cause other neural defects, and also it can cause night blindness by causing retinitis pigmentosa. I already discussed. Now look at this slide. Can you see an enzyme name? Yes, the name of the enzyme is peroxisomal enzyme. What is the name of this enzyme? Phytanoyl CoA alpha hydroxylase. That is PAHX. So PAHX is basically phytanoyl CoA alpha hydroxylase. Phytanoyl CoA alpha hydroxylase is basically the enzyme, and that is defective because of the genetic defect PAHX gene, and because of this genetic defect you get Refsum disease. And as this enzyme is not there, what will happen? I already told you, there will be accumulation of phytanic acid, and that will lead to blindness, that will lead to ataxia, and that will lead to retinitis pigmentosa, and that will also lead to different skin condition like ichthyosis. I will show you picture of ichthyosis. Very important. Sometimes they may give you a picture of a ichthyosis skin condition and retinitis pigmentosa together. Skin condition, ichthyosis and retinitis pigmentosa together, along with ataxia, hearing problem, all these will be there together. So that is Refsum disease. That is due to an enzyme defect. Now look at this picture. This is basically a clinical case of a 29 years old female, and she comes with ataxia, or she has ataxia since 2 months, and you can see the fundus. When you check the fundus, you can find out what? Black pigment like things. So these are basically retinitis pigmentosa. This is diagnosis of retinitis pigmentosa. Ataxia is there. Along with that, you can also find out hearing loss in this female, hearing loss. And when you check the skin, you can find out ichthyosis. This is scaling like, so it is ichthyosis. So now can you guess what is the diagnosis of this patient with ataxia, retinitis pigmentosa in fundoscopic examination, fundus examination, and skin condition of ichthyosis comes with ataxia and hearing loss? This is Refsum disease. So this is me, this is the end of this video. If you like this video, please subscribe this channel. This channel contains many videos on different diseases which are important for examination like NEETPG and inicet. So if you are preparing for NEETPG, inicet, please subscribe this channel. Thank you, have a nice day, bye bye.